Mountbatten commits itself to supporting anyone, anywhere, anytime. Anyone, meaning that everyone who needs our care will get it. Anywhere, that means within the place that you live, 24 hours a day, 7 days a week. And any time means any time that you need us. My name's Nigel Hartley and I'm Chief Executive of Mountbatten. Over the past year, we've focused on three very, very specific things. And we believe that these three things really lie at the heart of our responsibility to our local community. The first is that we're available to everyone who needs us. We can't afford to ignore anyone who needs our care. And at the moment, we know that not everyone who needs Mountbatten is getting access to what they need.
Mountbatten supports anyone as they're coming towards the end of their life. So that could be in the last 3 to 5 years of their life. So that's anyone, doesn't matter what condition. I think traditionally people would know that hospices saw people with cancer, but actually we see people with any condition as they're coming towards the end of their life.
I was diagnosed with heart failure and liver cancer about 4 years ago. Mountbatten's helped me because they've opened a new chapter in my life. My heart always told me that Mountbatten was for dying, but since being referred to Mountbatten from discharge from hospital, I've realised that Mountbatten is more than just giving up. It's taught me to believe in myself, it's taught me to be well, and it's taught me that a hospice is more than just dying.
I've lost the use of my feet or my legs through nerve endings. They've brought me through 3 times to walk again, which I never did. I didn't think I would be able to, but they brought me through.
At Mountbatten, we typically look after someone for a number of years. That will be from the point where we can start supporting them to manage symptoms and understand how to maybe make some adjustments in their life to still achieve the things that are important to them. And that could be through just our coordination centre, supporting them via a telephone, or it could be at our John Cheverton or Hazel centres, making sure that those people feel connected, part of a network, and really well supported.
So we're committing ourselves to our community. It's our responsibility to make sure that no one is ever ignored. So working with our general practitioners, district nurses and other professionals out there across the community, as well as the public themselves, to realise that we're here for everyone is a really important part of our mission and a really important part of our future.
Across both of our hospices in Hampshire and the Isle of Wight, our reach has really grown exponentially across both those areas. We're reaching more and more people, which is part of our strategy. One of our key strategic aims is to reach as many people as possible when they need us.
We try and really ensure that when people need to reach us for support, we're not trying to give a one-size-fits-all, and we're giving different options for different people. They can access online information on our website. We have open groups that people are welcome to drop into as part of our Living Well programme. And we also have a number of routes through a referral from a health professional, which people can then attend a group with peers going through similar experiences and symptoms. And finally, we have our gym, which we have a lot of people access to absolutely optimise their strength, fitness, and also just lift their mood and motivation.
Now I go on a Monday building banter. On a Wednesday we call it a wellbeing day, but on a Wednesday I compose a quiz.
It's somewhere to come and meet people who are in similar situations to what you're in. It's company and being able to get out easier with transport, etc.
When I first ever got suggested through my doctor when I started getting ill about coming here, I was a bit dubious because of, hospice was the word. And oh, that doesn't sound good, sort of thing, as you would. But it's just a generalisation. And when they said about coming there, I was really nervous about it and worried. But once I was in, no time at all. It's just everybody's fantastic. You'll calm down, you forget what you're in here for.
For me, it's the way they've changed my life. They've given me a focus that I didn't think I'd ever find. I lost my wife 4 years ago and I was diagnosed myself. Went into a really, really dark hole. Totally gave up the will to live. But Mountbatten changed that for me. You know, they put a spring in my step and it's not just affected me, but my kids are like, Dad, we can relax now, we can see you in a better place, you look happier. And they've given me tools to accept that grieving is a normal process. They've given me tools to understand my illness, it's not the end of the world. And they've also given me the reassurance that they're there, should I ever need them. Day or night, you know, I've got out of hours numbers. And for me, going to bed at night knowing that something's on the end of a phone, that's priceless, absolutely priceless.
We need to get to know you earlier in your journey. We know that people are living longer. The results of the 2021 census show us that we have a community now with a much, much older population, and that will continue to grow. So looking after people longer is really, really important. So getting to know people earlier, making sure that people are not afraid to come to us when they need our support is really important to us. So the second thing, over the last year and as we move into the future, we will ensure that no one who needs us is ever ignored. Our service is available 24 hours a day, 7 days a week.
Very often they access it through a health or social care professional who they're involved in, but they can equally ring our 24/7 coordination centres, and the coordination centre is here for anyone again as they come towards the end of their life, their families, and indeed, you know, we have health and social care professionals who phone. We're open 24/7, so every day of the year.
And ensuring that we're all a lot more comfortable with the conversation around death, dying and bereavement will continue to sit at the heart of who we are and what we will do in the future.
Death is the one thing in life that you're going to be heading for. And, you know, if you talk about it, it's so much easier to plan when you're dying.
It's important that Mountbatten sort of enable that amongst the community because it's something that the more prepared we are for it, the more we're talking openly, the more we're able to actually achieve the things we want and feel like we've got control at that time when things are perhaps a bit stressful or a bit challenging.
When people do talk about it, it's not scary, you know, and actually within the place that I've worked on IPU and in the community and I've had these discussions, we end up laughing in some ways because they're planning their funeral and it's actually quite rewarding for them. And actually when the family are on board, no one's going to be stressed afterwards because you don't have to think, oh, did I get that right? Is that what mum or dad wanted? Everybody knows what the plan is, how it's going to be paid for, and everybody can enjoy that last period of time with their family.
Death is not always a catastrophe, it's not always a disaster. We live together, staff, volunteers, patients' families and the public. We live death through life. And life is full of many, many different experiences. I guess what we find here at Mountbatten is we share them all. As people come to the end of life, they tell us their story. Sometimes that story can be sad, but often it can be hilarious, it can be fun, it can be full of achievement. We really want people to know that when they come to the end of their life has truly mattered. Mountbatten commits itself to supporting anyone, anywhere, anytime.
Anyone, anywhere, anytime.
Anyone, anywhere, anytime.
Anyone, anywhere, anytime.
Anyone, anywhere, anytime.